The first thing I would say that comes to mind is the pain, because that's the most common complication for sickle cell patients. The way that I like to explain what the pain feels like, slightly not, I mean, of course, you're not going to know the extent, but as a kid, sometimes people like to like put little rubber bands on their finger and kind of like, tie it up, and then you'll slowly see like your finger turning blue. And then shortly after, you'll start to feel a little bit of pain. And as soon as you feel that pain, you'll say, oh my gosh, let me just take it off. Now, with a sickle cell patient, it's similar to that, but we can't take it off. The pain is always going to be there. And the only treatment that we have is pain medication, blood transfusions, or IV fluids. There is the bone marrow transplant, but a basic treatment is just pain medication, transfusions, and IV fluids. But as a patient, it's very difficult because it can happen out of nowhere. It's not really always a trigger. My main triggers would be like the cold weather, or like a pool temperature. So like sometimes the pool will be too cold. And what would happen is that it would constrict my blood vessels, causing my red blood cells not to flow properly. And that causes the pain. So I do have to be careful, if I am on vacation, I do try to stay away from going to the pool. But if it's like a tropical island, and the beach is nice and warm, I can enjoy it, but I just have to, just be careful. The cold weather, the same thing. It constricts your blood vessels if it's too cold outside. I live in New York, so we do have some brutal weather here, and we just had a few blizzards. So I just stayed inside, made sure that I was warm, turned the heat all the way up. Constantly, of course, drinking water. Drinking water is extremely important for sickle cell patients to keep that blood flowing. So that's something else that, for me, that I deal with sickle cell. Stress is even a factor. I'm in school right now. I'm actually in my last semester, but going to school, trying to get my bachelor's for biology, it can be, stressful sometimes, managing my classes, making sure I'm getting all great grades, good grades. And I have to make sure that I'm taking care of my body. So whether that's making sure that I'm scheduling my classes appropriately to make sure that I'm not too overwhelmed, or seeking help so that my classes won't become just too much for me and I get too stressed out and I can end up having a pain crisis. So it's just really being careful and taking care of your body and knowing what your triggers are and just being gentle with yourself. As a sickle cell patient also, we do have many trips to the hospital, to the ER. And that can be quite, it can be a lot because, when you're in a lot of pain at a level 10, a lot of the hospitals, sometimes they're overcrowded. It's hard to get you back into the ER or to see a doctor. There's tons of patients in there. They have to see everybody. So it can be difficult, just dealing with being in the ER. But that's where I feel like support comes in handy, making sure that you do have that support system that can be there for you, to comfort you, to kind of just relax you in those moments, because being at a level 10 pain, your body is already at the ultimate stress level. You're very just probably in tears, or your body is just going through a lot. So you need someone there, or something that you can do to try to calm your body and to relax and breathe.